Good afternoon, everyone, and welcome. Thank you for joining us. This is another edition of Safety Included, the Workplace Health and Safety webinar series being presented by Encompass Michigan, the statewide network of comprehensive human service providers working together to develop independence and achieve inclusive communities. Our topic today is bloodborne pathogens. My name is Todd Culver. I'm the president and CEO here at Encompass Michigan, and I'll be joined momentarily by our education coordinator, Katie Kindy, and we're glad to be with you. This material was prepared under a grant from the Consultation, Education, and Training, or SET division of MIOSHA, which is a part of the Department of Labor and Economic Opportunity. Encompass Michigan has a long-standing and valued partnership with MIOSHA, and we appreciate their support. My responsibilities at the association include leadership in program and strategic planning and development, financial plans, all in accordance with our core purpose, mission, and values. It's been my privilege to be with Encompass for a long time, since 1995, and started my career here actually directing this safety project. So I've been connected to it for many years and have served in other capacities as well. As that project director, in my capacity to lead the project, I did provide a lot of health and safety training and technical assistance to organizations that provide services and supports for disabilities throughout Michigan. And prior to coming to Encompass, I did work in the manufacturing sector for an automotive supplier, and my responsibilities included occupational health and safety. So I've stayed connected with the content through the years, and I'm very pleased to be reconnected in a meaningful way with this project. And we've added a new perspective to it. And to bring you that perspective, I'm going to turn it over to Katie to introduce herself for a moment.
Thanks, Todd. I'm actually a 36-year-old autistic self-advocate. I've completed multiple leadership programs as well as getting a master's in education with a focus in learning design and technology from Wayne State. Um, I am now on the board of the Michigan Advocates to End Seclusion and Restraint. And in my spare time, I like gardening and giving free plants away to neighbors lately. And I do a lot of crafty stuff as well.
Thanks, Katie. So a few notes about the content before we launch into the specifics of the topic. First and foremost, inclusivity is very important to us at Encompass Michigan, and this presentation was crafted with that in mind and with all needs in mind. We'll try to avoid using too many colors and pictures. There will be some image content, so when we do that, we'll try to describe them, particularly for low vision users. And there will be handouts available in a shared drive, and a link will be posted. It looks like Katie has posted it in the chat. Thanks, Katie. The project overall is based, that we call Safety Included, is based on federal OSHA's recommended practices for health and safety programs. If you're familiar with that initiative, it presents a step-by-step approach to implementing those programs, and it surrounds 7 core elements. The main goal of safety and health programs, when they are effective, is prevention. It's to prevent workplace injuries and illnesses and the suffering and financial hardship those events can cause, not just for workers, but for their families and for the businesses that employ them. These practices use a proactive approach, and this is a little bit different from many traditional, not all, but many traditional approaches to safety, which are often reactive, meaning a problem is addressed only after somebody gets hurt or sick, if there's a new regulation that's issued, or perhaps there's an inspector that comes in from outside the organization and finds a problem that needs to be addressed. But these practices that are part of the federal OSHA guidelines and our approach to health and safety at Encompass Michigan recognizes that finding and fixing hazards before they cause injury or illness, and today's topic we're really focused on illness, is a far more effective approach. And what that means for us is that, in our view, there's always something about an incident that led to an injury or illness that could have been different. In other words, accidents don't just happen. We don't subscribe to that. It's important for all of us to continually assess the landscape in which we're working to identify the potential for a problem and then fix it before it occurs. So that's what this presentation is all about through the lens of bloodborne infectious diseases, and it does provide a framework for all effective safety programs that we'll actually talk more about in another session. We'll also provide, we hope, clear and structured visuals and graphics that will support comprehension for all learners. We'll talk about the concept of delivery in a way that minimizes sensory distractions for both virtual and in-person settings, some options for both verbal and nonverbal participation, some suggestions for interactive components that can promote engagement without overwhelming, particularly folks who are neurodiverse, and even some additional details like time-buffered schedules that can allow for processing and reflection. So as we go through the content today, I'll be talking more specifically about the MIOSHA standard and the compliance aspects of bloodborne pathogens, and then Katie will address some of the concepts that are involved in presenting any safety content really in a more inclusive way. Because the bottom line for us here at Encompass Michigan is that a safe workplace is sound business, and that's true for everybody, regardless of neurotype. So what I'll talk about then is the MIOSHA standard on bloodborne infectious diseases, the accompanying responsibilities for employers, and the requirements that that standard dictates. There are a few definitions that are key to understanding the rule. We'll talk a little bit about the diseases that these pathogens can cause and some of the situations that can put us as employees at risk, both by job task and in certain categories. The most important thing that I'll cover is how to protect yourself. And again, that's the bottom line in terms of a preventive approach to this issue, is understanding what the risks are and how to protect ourselves accordingly. What Katie will discuss is some considerations for training for employers that involve building trust with the audience, equipping folks who are not neurotypical to respond to an emergency in helpful ways, the concept of sensory overload and some sensitivities, as well as participation that folks may engage in learning that can be verbal and nonverbal, the concept of using clear signage when promoting comprehension of safety issues, a topic that has to do with the way that we use our bodies, which is proprioception, and again, time buffered schedules and how that impacts memory capacity, as well as training locations. We do have some resources for you to access. I see there's a comment in the chat about not being able to download, but Katie will share those afterwards as well to make sure that you all are able to connect with these. So the first important concept within what's called Part 554, the MIOSHA standard on bloodborne infectious diseases or bloodborne pathogens, is the exposure determination. It's the primary responsibility for employers, which is to evaluate both routine and reasonably anticipated tasks and procedures to determine whether there's actual or reasonably anticipated, that's a phrase that's used repeatedly in the standard, employee exposure to blood or other potentially infectious material, and I'll explain what those are in a moment. And employers are also responsible for maintaining a list of those job categories where there may be an exposure. There's training that's also required for all who face that exposure as part of their job duties. This needs to be offered at no cost and during working hours. And this is one of the MIOSHA standards that is not only required for training to be delivered at the time of the initial assignment that puts the employees at risk, but there is an annual refresher requirement. So folks should review this material every year, and it should be at appropriate levels to promote employee understanding and safety, which is kind of critical to the manner in which we approach health and safety at Encompass Michigan as well. Some definitions. A pathogen, a bloodborne pathogen, is a microorganism that's present in human blood that can cause illness. These include two strains of hepatitis, the B and the C strain, as well as the human immunodeficiency virus, or HIV. And contaminated means the presence, again, or reasonably anticipated presence of blood or other potentially infectious materials. And those other potentially infectious materials include the body fluids associated with sexual activity, some fluids that are really more relevant to medical procedures, and it does include saliva in dental procedures because of the potential for the presence of blood. What that means, and this is really more relevant for folks in general industry who are perhaps providing first aid or maintenance or custodial tasks. What's not considered other potentially infectious materials are urine, feces, and vomit, sweat and tears, or saliva, unless, again, it's visibly contaminated with blood. So the risky situations, the situations that can put an employee at risk. The first is contact. That means contact with human blood with non-intact skin. A common example of that would be if an employee were to render first aid without protective equipment. So if they didn't put gloves on first, treated an injury where blood is present, and that first aid provider had on their hand a cut or a sore or a scratch. The next is through contact with what are referred to as mucous membranes, the eyes, nose, and mouth. That can happen if there's a serious accident in the event of a blood splash, but more likely in general industry through accidental secondary contact. For example, if a first aid provider treats an injury, even if they have gloved hands and then inadvertently forget what they're doing and make contact with their hands or their face, that can cause an exposure. And the most significant risk is when there's under the skin contamination, a wound from a contaminated sharp object. The most frequently occurring example in a healthcare environment is a dirty needle, but it can also occur with other sharp items that have been involved in an accident, such as broken glass. So these are the three primary risky situations that can put individuals in harm's way. There is an appendix. So those are the tasks that I referred to at the beginning. In terms of job categories, there is an appendix to the MIOSHA standard. It does list the job categories that are likely impacted by the rule, and these include the obvious, such as healthcare personnel. Those are doctors, nurses, dentists, and dental care workers. But it also includes folks more commonly employed in general industry like housekeepers and janitors and maintenance workers. Some of the signs and symptoms of bloodborne infectious diseases. Hepatitis B, the symptoms are mild, can be mild and flu-like, such as fatigue, stomach pain, loss of appetite, and nausea. And if it progresses, it can lead to a yellowing of the eyes or skin, known as jaundice, and a darkening of the urine. However, individuals infected with hepatitis B will often show no symptoms for some time. It's one of the concerning aspects of the disease and how it progresses. With hepatitis C, it can be symptomatic or result like Hep B in just mild illness. If symptoms do occur, 1 out of 5 may experience that yellowing of the eyes or skin and the other symptoms that I mentioned, including those that are similar to the flu. After acute infection, up to 25% of persons appear to resolve their infection without treatment. With hepatitis C, regardless of how it's resolved, it does not provide immunity to reinfection. So chronic HCV infection can develop in the remaining high percentage, 75 to 85% of persons infected, and that in the majority of cases results in chronic liver disease. Extreme fatigue is a very common symptom in persons with chronic hepatitis C. And then the third is human immunodeficiency virus. Again, HIV is the virus that causes AIDS. It can be asymptomatic or mild as well. People may not have any symptoms when first infected. And within a month or two after exposure, some flu-like symptoms may develop that include fever, headache, extreme fatigue, and sometimes enlargement of the lymph nodes. And other symptoms months to years before the onset of AIDS can include extreme fatigue and lack of energy, significant weight loss, frequent fevers and sweats, particularly at night, or skin rashes or other skin disorders. So, very serious illnesses, all three. The good news is that there is a preventive vaccine available for hepatitis B. The number of new infections here has declined dramatically in recent years, primarily due to routine vaccination that's been going on for a couple of decades now. There are 3 shots in the series that are administered over the course of 6 months. There is a 2-shot option from one of the brands, delivered about a month apart. And the Centers for Disease Control does recommend vaccination basically for everyone under 18 years of age, and specifically any adult who is at risk. And that's still very clear on the CDC website. If you've followed media reports recently about changing guidelines for vaccinations from federal advisory panels, while there was a vote recently to change longstanding Hep B vaccination guidelines, the official CDC guidelines have not changed. In terms of how this intersects with the MIOSHA requirement, the vaccine is required within 10 working days of the time of initial assignment if the employee is at risk as part of their primary job duties. An employer then shall make the Hep B vaccination available to each employee who's at risk within that period of time. An employee can decline that offer, certainly, but if they later decide to accept, the employer needs to respond to that and provide the vaccine at that time. And there is a first aid responder option, which is important to many in general industry, which is that the offering can be postponed if the primary job assignment is not the rendering of first aid, if it's only what's referred to as collateral duty. However, it does need to be offered within 24 hours of an event where the responder renders assistance in any situation involving the presence of blood or other potentially infectious materials. The most important concept from that, through that preventive lens that I mentioned earlier, is universal precautions, and that quite simply means be careful all the time. Assume that all human blood and all body fluids are infectious, behave as if the stuff can make us sick, and then respond accordingly and protect ourselves so that we don't, so that we stay healthy. So whether treating an injury or conducting a cleanup, universal precautions should be used before we get involved, and taking the necessary steps to make sure the potentially infectious material doesn't get in you, doesn't get into your system, and doesn't get on you, doesn't get on your skin, particularly if there's any compromise in the skin surface. That's what will keep us healthy, and that's what universal precautions means. Sometimes that involves the use of personal protective equipment or PPE. The most important item in that is single-use gloves. These can be latex. Katie will talk about some alternate materials for folks who have certain skin sensitivities, and that can apply with allergies as well, such as nitrile or vinyl gloves. CPR masks can be available if that's still an authorized procedure for first aid responders in your business. And eye protection and surgical masks and gowns, other types of protective gear that you would see more in a medical environment, should also be available, but don't necessarily need to be deployed with every single response. For glove removal, there's a specific technique that's demonstrated through images on the screen. The first image shows grasping with gloved hands. There are 2 gloved hands in that image, and one of the gloved hands grasps the outside glove with that opposite gloved hand. The next image is of those same 2 gloved hands, but in this instance, the glove on one hand is being pulled off away from your body to make sure that it doesn't, if there's any contaminated material on the surface of those gloves, that it doesn't contact you, and then to turn that glove inside out. And then the third image is also 2 hands, but one of them is now ungloved. So if we hold the removed glove in the gloved hand, then slide the fingers of the ungloved hand underneath and peel that second glove over the first glove, then you have one nice neat package that's contained any of the potentially infectious materials inside. After which that those gloves should be properly disposed of. Items, again, turned inside out, placed in designated containers. Designated means it will have a label on it that we'll show you in just a moment. Any clothing that gets contaminated should be washed, and hands should always be washed, and any other exposed skin with soap and water. Waterless disinfectants and alcohol wipes can be effective as germ killers as well, but a sink with soap and water and a good scrub is still the most effective method. For cleanup procedures, first and foremost, wearing the PPE is important, and then the right materials are important as well. So there are disinfectants that are made specifically for this purpose. They will be registered with the EPA and indicate that designation on the label. But a simple solution of bleach and water is also effective. The appropriate ratio is 1 part bleach to 10 parts water. And also important to remember to use tools if we need to pick up a sharp object like broken glass, to use tongs or broom in a dustpan to pick up that stuff and not use our hands, even gloved hands. In terms of regulated waste disposal, if there are contaminated materials, that includes liquid or semi-liquid blood that's got or other potentially infectious materials, along with the contaminated items, should be placed in a closable biohazard or red-colored container. The images on the screen are on the top is a biohazard label, and on the bottom is a container that displays that biohazard label to indicate that that's the appropriate receptacle for regulated waste. And the last part of the employer requirements piece that I'll discuss is the written policy that addresses these issues, and it's referred to as an exposure control plan. And it is required of employees or employers, excuse me, and it must include the exposure determination that I defined at the beginning. This defines who is at risk, who among that employee population is going to be at risk of exposure, what the employer's hepatitis B vaccine policy is, and what options are for both employees and employers, so that folks understand when it must be offered and how to respond if there's ever an incident. Control methods will be described there that involve the use of universal precautions, personal protective equipment, describes facilities for hand washing, as well as specific procedures for any disposal of regulated waste or needles. And also a post-exposure evaluation process, which we didn't talk about. There will be reporting requirements, immediate treatment for folks who have incurred an exposure, and ongoing follow-up that's prescribed at a certain frequency in the rule. Remember that training is required when employees are assigned to a job that puts them at risk, and there is an annual refresher. And there are very specific record-keeping requirements, medical records for folks who are exposed, training records, and a separate document that's referred to as a Sharps log that is available. A template or an example is available through MyOSHA set resources and is required under the standard. So I think the most important thing to remember here is bloodborne pathogens are disease-causing agents that can make us sick and make us really sick. And so there are certain things that we can do to protect ourselves, primarily the practicing of universal precautions and the use of personal protective equipment. And in terms of discussing this issue and others relevant to health and safety in effective ways to be more inclusive, regardless of neurotype, I'm going to turn it over to Katie.
Thanks, Todd. So, my section of the presentation is, as we talked about during the learning objectives, is how to train all neurotypes effectively, because we believe that a training is more effective when you take everyone's needs into consideration. So, employees of different neurotypes may have different needs to consider. So, talking to employees directly about their preferences is the best way to ensure all learning needs are met. So, ask your employees what ways you can improve the trainings that you do for them. You can also create a trusting relationship so that in times of stress like injury or spillage of bodily fluid, employees can go to employers without fear. Neurodiverse employees especially can have anxiety, so be patient. When you're speaking, even in an emergency, try to always speak concisely and in a neutral tone. Um, so what that means is you want to state the exact needs or what you're trying to convey. Um, that would also include avoiding vague idioms, metaphors, or corporate jargon like touch base or circle back. You want to provide concrete contexts and clearly explain what is needed, why it's needed, and when something is needed, and avoid nonverbal assumptions. So don't judge engagement or honesty based on eye contact, tone of voice, or body posture. Also, some employees may need additional support and freedom to ask questions to better understand. It is important to forge this trust early on. And you do that by treating all questions with respect so that employees do not fear being ridiculed in the future. And before I get into this next part, I just want to say that asking questions is a great way for people to not only process the information that they're learning, but also be able to lock in that information into their brain. So, if someone learns in that way best, it's always best to treat questions with respect. So, for example, let's say there's an employer and an employee talking. The employee asks, "What types of gloves are these?" And oh, I'm sorry, I forgot to mention there is an image of gloves to the right side of the screen that are blue and on two hands. Um, so just imagining those are the gloves that are being talked about. The employee asks, "What types of gloves are these?" The employer will say there are medical grade gloves and they can be used for first aid and cleanup. And the employee asks, "Are they latex free?" And let's say like the manager or employer, maybe they have a box on them and they read the box and they just say they're called basic SynGuard nitrile examination gloves and they're powder free, medical grade, and latex free. Um, the employee asks, "Why do we get blue gloves?" And the manager will say, "I'm not sure. It's just the ones that we order." Um, the employee asks, "What sizes do we have?" And the manager says, "We have small, medium, and large." The employee asks, "Can we get other colors?" And this is an important one because the manager will say, "I'm not sure. I may have to get back with you on that because they have to review things." Can I bring my own gloves? The employee asks. And the manager response is, "It's company policy to use the gloves provided, which will help keep you safe. They are designed to be appropriate for the job we must do." So, again, these are all like responses and questions, that are being very respectful. There's a couple of more. Um, the employee asks, "What if the glove box is empty?" The manager says, "You can talk to Stacy. She has the key to the supply closet and can get more gloves." Um, the employee asks, "What if Stacy's not here that day or busy?" The manager says, "Let me know. I can also unlock that closet too, but it's Stacy's job to do it." And then the last and final question is, the employee asks, "In my last job, someone stole all my gloves. What if someone takes the box of gloves from the closet?" And the manager says, "That's highly unlikely here, but if you suspect this is happening, please let me know right away." So, again, these are all questions that, may bog down a training a little bit. You can always, if there's too many questions at once, you can always tell an employee to, ask questions afterwards, but addressing them during the training is always best because it helps. It's not anything to do with defiance or trying to waste time. It's actually helping that person, the employee, learn better. So for neurodivergent employees, handling workplace emergencies involves a combination of pre-established strategies and on-the-spot adaptations, such as developing clear written emergency plans, minimizing sensory overload, and creating a support system with clear communication channels. So consider creating a personal emergency checklist between the employee and manager. That can work really well, especially if they have a good trusting relationship. There also should be easy to access information for employees to contact supervisors during an emergency. So, multiple forms of the same information accessible to everyone, whether that's phone numbers that they can save to their phone, maybe some signage around, or a packet that's easily available. And just make sure that your employees know where the spots to access that information is. So also, like I was saying earlier, just consider giving a direct phone number for the employee to put in their cell phone, a business card size reminder for their wallet that says in case of emergencies, call blank, a card that can fit in the employee's name badge or lanyard with contact information, a sign or what to do binder in the workspace where hazards are that has information on how to contact someone in an emergency. If the employee has a close coworker, consider that having them be an emergency buddy in case your neurodivergent employee may go nonverbal. And just to kind of explain what an emergency buddy is, you can call it something else. It's kind of just a term, a general term that is just supposed to you know, be given a title to someone who is a trustworthy coworker for a neurodivergent employee in times of an emergency who can guide them during moments they are overwhelmed. And overwhelm can happen during sensory overload. If you're not familiar with that, it's a state where the brain receives too much sensory input to process, and that leads to symptoms like anxiety, irritability, confusion, and physical discomfort. It can be triggered by common stimuli such as loud noises, bright lights, strong smells, and crowded spaces, but also by emotional stress, physical fatigue, or environmental changes. I feel like especially when it comes to talks about autism, emotional stress is not uh, talked about enough when it comes to sensory overload. So during sensory overload, information is less likely to be retained, and this leads to an unsuccessful training. So recognizing triggers and using strategies like reducing exposure to stimuli, using sensory aids, or finding quiet spaces can help you manage that. Auditory and visual considerations that you want to consider for your employees. A lot of people who are neurodiverse can also have comorbidities, such as low vision, or they may be hard of hearing. So you should always have large text and describe images or steps for anyone with low vision. And when speaking, ensure that you are using a microphone if any employees have low hearing. For those who are sensitive to scents, cleaning materials may be overwhelming, and there are ways to manage these scents personally, environmentally. Um, for employee personal management, just make sure that you have access to either dabbing something underneath your nose, whether that's like a vapor rub or lavender peppermint oil. Um, you can also do breathing exercises by breathing through your mouth, taking shallow breaths, or humming. Scented items like minty gum or strong mints can help. Also, make sure that all employees are wearing clean uniforms and socks daily to avoid carrying odors. And make sure that all employees are able to take quick breaks to step away for fresh air if overwhelmed. For environmental management, you want to make sure to remove soiled linens and clean surfaces, and then also make sure that there's proper air circulation and ventilation. Make sure that employees have access to using fans or opening windows when possible. So, tactile sensitivities, this is something that Todd mentioned earlier that I would talk about. Those who are sensitive to the feel of latex, soft, thin silk or cotton gloves can be used underneath normal gloves. Um, when it comes to masks, those who not like the feeling of normal masks, you can use soft, breathable fabrics like cotton or silk in the appropriate places. Also, there are things called ear savers or hats that can be used to reduce the wear of stress or the reduce the wear of the straps from masks on your ears. Also, make sure that masks have options for toggles or even Velcro to customize the fit and reduce the tightness of those masks. Um, So remember, when it comes to PPE, employees of all neurotypes may have issues, but neurodiverse people are more prone to comorbidities. There are skin allergies to latex, so have accessible hypoallergenic gloves. I know there's actually some research I've done for one of our other presentations where there's accelerators in the process of creating latex gloves. So that can also cause an allergy. So just be aware of that. Um, Consider proximity, comfort, and consent as well. This is something that should be discussed beyond everyday interactions as well, um, not even just for trainings. So, something as simple as placing a hand on an employee's shoulder may be extremely uncomfortable to a neurodivergent employee. So, when it comes to physical contact, always ask for consent. Me personally, I don't do many in-person events, but when I do, I always make sure to kind of hold my arms out and say, hey, like, would you like a hug to people instead of just reaching in for a hug. That verbal um, consent is always important to me. So how this applies to trainings, let's say you have an interactive in-person training on glove disposal, and a trainer may need to hold their hands up close to a neurodivergent employee to show each step of glove removal. That might make that employee very uncomfortable. So the trainers should be asking if it's all right to be up close before showing each step. It's important to let all employees learn by removing their own pair of gloves or interacting with things themselves, because that does help in the learning process. So consider some employees may prefer verbal or nonverbal communication. So nonverbal isn't just about not talking. It's about using diverse communication methods, like gestures and visuals, beyond speech. Especially if people face sensory challenges, it's important to be able to make these available. Sometimes people process language differently as well. Sometimes, as we discussed before, sometimes nuanced talk is a little hard for people to understand. So it's better to be literal and not nuanced. And also when it comes to neurotypes that get that overwhelm or sensory overload, sometimes they may need to go nonverbal or they shut down. To help them through this, it's best to communicate before a shutdown for preparing for these moments. But if this happens and you're not really sure what to do, just be patient. Try to have clear, direct communication with the person, respect their cues, and understand their unique sensory processing needs. Not required, but is a helpful tip I've seen online and while doing these trainings. Some employees may even prefer having signs on their door or on their name badge that show their current availability verbally. To the right of this slide here, there is an image that has three signs. One is a sign that says "Come in" and it has a green background. There's one that has a yellow background that says "Important only." And then there's a third sign that is red that says "Do not disturb." And that leads into the next bullet point on the slide, which says color coding these signs or these markers can be very helpful. So make sure when you make trainings that all materials related to the training are very clear and concise. There's some examples to follow. Kind of like when I talked about business jargon earlier, imagine a notice that says the following: due to new ordinance 3.7 of the Safety Committee, we must all be cautious of sharp materials and follow emergency procedures. And following that is about like, let's see, 8 steps that are all very like in high detail explained. And this is all on a little notice for putting on the wall, maybe next to certain objects in the workplace. And looking at this, it's the text is very small, and if this was up on the wall, it would probably be easily overlooked, and it wouldn't be very easy to read. So, especially during emergency, this is not very helpful. So, what we recommend is that on the next slide, there is a sign that I created that says biohazard at the top with some biohazard symbols. There's a little exclamation point that says with next to it saying Sharps injury, act fast. And there's only 3 steps on this: wash, cover, report. And below that, on the same flyer, there is a phone number that says need assistance and lists a fake phone number. But essentially, this image that is uh, posted on the side of the slide is just supposed to show how things can be helpful in the moment without explaining too much information, especially during an emergency. Injury management should be first and foremost in a moment like this, and a first aid kit should be nearby this sign, maybe having um, an arrow showing where it is. Um, Also, we recommend if you do that, maybe next to a biohazard box, and maybe have like an information packet with pictures and steps on what goes in the box, how to fill the box with waste, and even a QR code to a video. There should also be refresher trainings in person to ensure everyone knows what to do. Another topic I like to talk about during these trainings is proprioception. So, it's the awareness of one's body. Some neurotypes are not able to perceive themselves well. This can lead to a lot of different things, especially when an employee is hyper focused on a task. They may work themselves too hard physically without even realizing until after a task is done. They may sit at a computer for so many hours that they, hurt their neck and shoulders. They may walk around so much that their, over the years, their knees start to get damaged and they don't even realize it. So ensure if an employee has poor proprioception that they take extra precautions when working with sharp objects. Um, and be proactive with reminders of self, especially where it's appropriate. Todd is always really good with that in the workplace with me because I really get hyper focused during the conferences that we hold in the fall, which there's one coming up pretty soon. Um, and I'll start moving around a bunch of boxes here and there. But even though I know because it's my back and I have a very bad back, and he knows, he's usually the one reminding me, like, hey, you probably shouldn't be moving all that heavy stuff around because your back might not like it. And then I thank him profusely because sometimes I just start doing things without, thinking about how it may affect me because I want to do a good job and I want to make sure everything is done correctly, so much so that I kind of forget like how it affects me. So, and another consideration, especially when it comes to working with biohazards and things like that, if your employee is prone to touching their face or eyes, um, that's another little proprioception related thing. You may want to have them use safety glasses. I literally just touched my face. uh Saying that. Now we're going into design methods of trainings, so that you can better create trainings that help all of your employees. Um, and one method is universal design. That allows educators and learners to set clear goals, anticipate environmental barriers, and create meaningful options and fully embrace human variability. In other words, just have multiple methods to learn safety. And this ensures that everyone has the resources they need to learn processes, regardless of what neurotype they are or what learning preferences they have. So consider making step-by-step processes, signs, videos, have them in multiple places, and plan on showing processes in person as well. This way everyone can have multiple options to learn the same information. Time buffered schedules allow for processing and reflection for all neurotypes. So consider having breaks during long trainings or breaks in video trainings. a 15-minute break for every 1 to 2 hours in person or live is a good, like, reasonable thing to go by. So be sure to break up activities or break up trainings with activities and discussions. Even after all you can do to make a training, consider everyone's memory capacity as well. So on average, it is estimated 50% of what is learned is immediately forgotten, and spaced learning helps retain what is taught. Active retrieval also helps you remember more information over time. And active retrieval or active recall is where you deliberately pull information directly from your memory instead of passively reviewing it. So, in other words, you want to apply this to your own trainings and apply it to your workplace, especially for your employees. Make sure that they're actively retrieving that information as often as possible so that they can retain that information. And I like to show this graph when I can, but I'll try to describe it as best as possible. So there's retention on the y-axis going up and down, and time going across the x-axis. And it's just showing how active retrieval works. The moment you learn something, the forgetting curve across the x-axis is very large, and the learner pretty much forgets everything. But the more points on the graph where there's active retrieval or active review, um, that forgetting curve starts to flatten out, and the amount of retention is much higher over time. So there's evidence showing that information retention for all neurotypes is also affected by location. So employees are more likely to remember information in the spot they learn that information. And this means that procedures should be taught in the spot they will be used. This may not always be possible, but especially if you're teaching someone how to retrieve items from a supply closet, let's say, you definitely want to show where those items are instead of just an image of it. If there's a procedure that they have to do in a certain spot all the time, you want to go to that spot and show what that procedure is. Um, so, thank you for staying throughout this training. I'm going to pass it over to Todd. And yeah, thanks, Todd. Up, you're muted, Todd.
Of course I am. The what you see on the screen are some resources that we used in development of this content. The first is the general industry standard from MIOSHA. There's a fact sheet about bloodborne pathogens, a sample exposure control plan, and there's lots of resources also on the CDC website. I hope this has been helpful to you. I think the most important takeaway for us for bloodborne pathogens is understanding the risk, utilizing universal precautions to make sure the stuff that can make us sick doesn't get in our bodies and doesn't get on our skin, and to know how to respond in the event that there is an issue. And as we're sharing this information with others, if you can take into consideration some of the very helpful resources that Katie brought to bear regarding neurodiverse audience. We wish you well. She did a lot of research in developing her portion of the program. And then those resources are on the screen as well. If there's any of this content that you would like some follow-up information on, please don't hesitate to reach out to us. And a reminder as we close that the content was developed through our partnership with MIOSHA's SET division that we're very grateful for. If you're interested in more training through this project, don't hesitate to reach out to Katie. You see her email address on the screen, and appreciate all the kind words in the comments section.